So, good afternoon, everybody. I'm Emily Briskin. I'm an epidemiologist with the Army Public Health Center. And today I'm going to be talking to you about a question that we deal with all the time in my job. And that question is this an outbreak? So, I've worked a lot on this project with my colleague Al Brown, so I wanted to thank him here. And I'm also a SMART Scholar in Phase 2 of the program, so I'd like to thank the SMART Scholarship Program for funding my education. So I'm going to ask you all to take a journey with me. Go ahead and lace up your combat boots and put on your uniform because you today are an Army Public Health nurse serving at Fort Nightingale somewhere in the United States. And at sick call this week, you've noticed that 4 soldiers have come in complaining of fever and diarrhea. And you test them in the lab for Campylobacter, which is a bacterial pathogen, and all 4 of these soldiers end up testing positive for Campylobacter. So a lot of time, if you fell sick with a stomach bug at home, your mom might give you some chicken soup, and you lay in bed for a few days, you get better, you don't worry about it too much, you get over it. But in the military, gastrointestinal illness is actually a very serious issue because all of these soldiers have a very important role that they play. And so anytime a soldier falls ill, even if it's only for a few days, they're not able to be doing their duties toward the mission. So it's something we're very worried about in terms of medical readiness in the Army. Also, having soldiers up in the hospital or on sick call, of course, is a use of resources that doctors could be using to do other things. And if we see several soldiers who are sick with the same illness, it could be a sign that there's a deeper problem, such as contaminated food items or water sources that have become contaminated. That could mean that a lot more soldiers are about to get sick. So it could be a problem we need to look into. At the same time, we know people tend to fall ill. Sometimes the cases aren't always related. So you are probably starting to wonder, as an Army Public Health nurse, are these cases related and is this an outbreak? So we wonder, we have 4 cases of Campylobacter at Fort Nightingale. They're all among active duty soldiers, and this has happened over the period of 1 week. So in order to know whether or not this is an outbreak, first of all, we need to go ahead and define what the term outbreak actually means. So the widely accepted definition of an outbreak is whenever you see more cases of a disease than would be expected in a certain area or in a specific group of people occurring over a certain period of time. So if we apply this definition to our situation at Fort Nightingale, we could see our place is Fort Nightingale, our population is our active duty soldiers, and our period of time is 1 week. So you all probably noticed that an important aspect of the definition of the term outbreak is, are there more cases than expected? Well, you're sitting here and you wonder, how many cases do I expect to see in a normal week? 4 sure seems like a lot. Last week there might have been 1 case. I don't really remember how many there were before that. So you're a little bit worried and you're just trying to go off of a gut feeling whether or not this is more than expected. But what you might go ahead and do is reach out to us at Army Public Health Center, and you might ask us, well, how many cases would be expected? What is the baseline? And we could tell you that according to the CDC, it's only expected that about 5% of cases of gastrointestinal illness would actually be related to an outbreak. So it's possible that a lot of the cases you see wouldn't be related to an outbreak. But we need to look at historical trends in Army data to see what's normal and to determine whether or not we have an outbreak on our hands. So my colleagues and I at the Army Public Health Center went ahead and we just took in all this data that's reported to us on a daily basis for a period over the last 4 years. And we just grouped it by month. And so we looked at 6 diseases that the CDC says are 6 of the most common gastrointestinal illnesses in the United States. And you can see from this chart here that the total number of cases for all these 6 diseases combined ranges widely by month from about 4 cases to up to 20 or 30 cases of illness per month. And this is across the entire U.S. Army, all active duty soldiers. And it's over a period of 4 years. But looking at data in terms of a monthly time frame really isn't that useful for outbreak response. If you wait until the end of the month, you could have had an entire outbreak come and go in that period. So after we did this baseline analysis, we used this to identify the 3 diseases that were most affecting Army soldiers. And then we honed in on those diseases and looked at weekly case counts for those illnesses. So just to give you an idea of how we did this, you could look at each and every week over those 4-year periods. And in 1 week, you might see 1 case of Campylobacter and no Salmonella, no Shigella. The next week, you might see 2 cases of Campylobacter, 2 of Salmonella, 1 Shigella. And the week following, you might see a different combination of cases. And so from this, we were able to come up with a lot of count data. And many of you might know that count data is often well modeled by a Poisson distribution. So we went ahead and tried to fit the data to a Poisson distribution. And this Poisson distribution would tell us, for the number of cases observed in a week, what is the likelihood of seeing that number of cases? So a Poisson distribution generally has this shape. And so on this imaginary Poisson distribution, the likelihood of seeing 4 cases of an illness in a given week, you can just look, and you can see it's about 18%. So we tried to take that principle and fit our data to a model using this system. So you can see that Campylobacter fits that Poisson distribution really well, our data for Campylobacter. And if you remember, you saw 4 cases of Campylobacter in 1 week. So we're probably really curious, how rare was this? Well, if we go over to a weekly case count of 4, the likelihood of observing that count falls well below 5%. It's close to 3%. So you could say we would expect to see this many cases in 1 week in less than 3% of weeks across the year. So this is a very rare event. We should probably be worried about this. So that was it for Campylobacter. And we did a similar process for Shigella, another important illness. And you can see it doesn't quite follow that Poisson shape. So we ended up using a negative binomial model, which is just a variation on the model, to come up with the same principle that allows us to see the likelihood of observing a certain case count. And then Salmonella also followed a negative binomial model quite well. And then if we compare the models that we came up with for these 3 different conditions, you can see the distributions are quite different. So that just sort of serves to reinforce why it was very important that we take the data from each of these 3 conditions separately and analyze them separately to develop our threshold system. So now that we have all this information, we want to use it to create sort of a red flag system that's very easy for anyone to follow. So we take all of this data and all of these numbers, and we just apply some red flags to it that are very easy to see. So if ever you have a weekly case count that falls into one of these red boxes, you should know, well, there's less than 10% likelihood of this occurring. We should probably monitor this situation, and we may even need to investigate it. So for example, if you had Shigella and you had 2 cases in 1 week, that falls under the red flag. We should be worried about this issue. And going back to our issue at Fort Nightingale, 4 cases of Campylobacter falls under our red flag, so it's something we should investigate. So going back to this original question, 4 cases at 1 installation over a period of 1 week. Well, all of our analysis was able to tell us that there's actually less than 5% chance of seeing 4 cases of Campylobacter across the entirety of all U.S. Army bases among active duty soldiers in 1 week. So since Fort Nightingale is actually just a small subset of all U.S. Army bases, we know the likelihood is much less than 5%. So it's an extremely rare event, and it does warrant investigation. And one of the reasons that we didn't break down our analysis on an installation by installation basis is because the case counts would be very small, and it would be really hard to create a model with such little data. So that's why we went ahead and pooled all of the U.S. Army bases together, and it ends up giving us a very conservative threshold system anyway. So we think it's something that leaders can have a lot of confidence in if we come to them and say, it's a very small likelihood of occurring, we think you should invest in this. So in summary, surveillance only captures the tip of the iceberg. All of this data that we collect is really very imperfect and depends on a lot of human factors of people inputting their information, of which soldiers end up coming to sick call and which decide to just try to recover in their own beds. Things can vary seasonally. But despite all of this, our system has allowed us to present information to leaders in a way that's not just based on your gut or intuition. Because if you come to a leader and say, we need 3 people to help with an outbreak investigation, it's going to take several days, we're going to have to interview some of your sick soldiers as well as healthy soldiers for a comparison group, they're going to say, wait, we don't need to do this, let's forget about this, this is way too much work, we don't have time for this. But if you're able to come to them and say, no, we've quantified this. This is a systematic way to look at this. And we can tell you that, there's less than 5% chance of seeing this. We have a very strong degree of confidence that this could be an outbreak. Then they might be willing to invest some resources into an outbreak investigation. And it's only through outbreak investigations that we're finally able to get to the root of the problem and get to the basis of what is causing our soldiers to become ill. Thank you.